Hi, this is Dr. Naina of NainaMD Fusion of Science and Beauty. I'd like to welcome you to my first guest of the show, Mr. Jeff Klinger. And he represents Eclipse Medical Company. It's a great company where I get supplies from. I think it's so important, Jeff, that doctors and the audience should be aware of that really how we do our procedures and the supplies that we get to do those procedures should be the best. I mean, I think nobody really understands that. It's like you go to a doctor's office, well, where did this thing come from? Or where did this tube come from? A lot of times, like on my IV tubing, I have to have it latex free. I want it to be the DDPE free, free of any toxins. There's still a lot of IV tubing that has latex and that has toxins in it. So it's so important for the audience to realize that the companies and that doctors align themselves with or choose should be, vigilant of that. So today I want to talk about this is what I get from you, and it's I do PRP, a procedure, and I just want to talk about the procedure itself really because nobody understands what PRP is. Mm-hmm. But there's different ways of utilizing and doing PRP. So, Jeff, what does PRP stand for?
Well, PRP is the abbreviation for platelet-rich plasma. Mm-hmm. And platelets are in our blood, and they're responsible for healing wounds. Right. For example, when you cut your knee or cut yourself, mm-hmm. the platelets rush to the site of injury and commence the wound healing cascade.
Right, they have to that's how you heal, right? Pretty
Absolutely,
much.
yes.
Yeah,
mm-hmm.
yeah. And you get platelets, and you also get sometimes the growth factors, right? Go mm-hmm. there too, yeah?
Absolutely.
Yeah.
Your platelets are a rich source of growth factors.
And do platelets have stem cells in them too? Your own stem cells?
Platelets will attract stem cells to the site of injury.
They actually attract, right?
Mm-hmm.
Right.
Mm-hmm.
So tell me then. So that's the concept of the platelets, right? Because mm-hmm. to help heal. So PRP generally is a procedure done where people treat for the knee, like osteoarthritis of the knee or like knee injuries. Everybody kind of knows PRP and knee injuries. Well, how do you separate out the platelets? Mm-hmm.
So one of the reasons why so many practitioners love Eclipse platelet-rich plasma is our preparation tubes. Basically, all you have to do is draw a 10 milliliter sample of blood into the preparation tube.
Which is not very much, which is about how much? It's only like this much, right?
Yeah, it's a very small sample of blood.
Very small amount.
Mm-hmm. Mm-hmm. And so that tube is placed in the centrifuge for just 10 minutes and is spun at a high velocity. And that process separates the platelets and the plasma from your red blood cells.
Yeah, and that's we can do it I have that any doctor has it's a little device, right? The centrifuge, and it just spins and spins, right, until you separate it. Okay.
Yeah, it's not a complicated process.
No, it's really easy. I do it in my office mm-hmm. all the time.
Yeah, so it's 1, 2, 3. You draw the blood, spin it, and then it's ready for the practitioner to use. Right. And our platelet count is between 87 and 96% efficiency.
So what does that mean? It means that what you want to do is you really want to maximize and get as many platelets as you can in that fluid, right?
Exactly. Yeah. Exactly.
Where did the other if you didn't, because if I didn't use this, for example, device, what have you just tested and seen what some of the other platelet amounts are? If they're lower, they're a lot lower percentages, aren't they?
Yeah, there's people that spin the blood on their own in their own
because they think
laboratory.
They don't need to spend the money to get that tube because it costs money. I mean, I have to pay for that, mm-hmm. and it's not a small amount, but I do it because I want to give the best to my patient.
Yeah, right? For a minimal amount of time. You don't have to spend in the laboratory dealing with test tubes and spinning it and respinning it and doing a whole laboratory getting complicated, right? Yeah. You just have to spin it. In 10 minutes, you're ready. So it's great for practitioners to use. And because it has virtually no red blood cells or no white blood cells, it's just pure.
Basically, none of the what we call the junk, right?
Exactly.
Yeah, you eliminate all that.
Yeah, pure, clean PRP with an optimal.
I've seen the fluid, and you can tell because I've seen when there's other spin, right? Mm-hmm. I've seen the fluid is so nice and as light yellow, mm-hmm. And beautifully you can see through it. versus sometimes I've seen the fluid being a little cloudy, you know, in a lot of places.
Yeah, and other companies will have red blood cells in it, and that's counterproductive in the whole wound healing cascade.
Right. You know what else I love about this is when you give me that filter, there's an extra filter, so yeah, that also costs money to put an extra filter on it, but when I put that filter through, oh my gosh, that fluid is just like, I can see right through it. And the reason when I do that and when I do my procedures is because when I do inject it, the patients hardly have any pain.
Exactly.
Because it's like your own body fluid that's clean.
Absolutely.
Right? It's got very minimal inflammatory stuff in it.
Yeah, it's called an autologous procedure, which means the blood is extracted from the patient and put back in the same patient.
Very quickly,
and no...
Which is what the FDA wants. We don't want to manipulate it. We don't. We just spin it and put it right back. But we want to try to put as clean fluid back. And that's really the whole idea of what I brought you in today, was to tell the audience that if you like just go for a PRP, don't just think like you're just going for a movie. I mean, it's not... you need to ask those questions. Be intelligent enough to ask, wait a minute, how are you going to spin my blood down? Are you going to use an extra filter? You know, how are you doing this, right? Those are the educating the consumer, now they can ask those questions, right?
Absolutely. And there's some practitioners that will spin down PRP in the tiger top tubes, which are basic.
Just like a regular basic. It doesn't have so what you're getting at is it doesn't have a filter to actually to help bring all the platelets and all of those things that, I mean, the red blood cells and everything else that you don't need, right?
Right. And the tiger top tubes have ingredients that are not meant to be re-injected into the human being. So these are sterile products that are optimal for patient use.
Comply with the FDA what they want. Keep the procedure sterile. You know, do it the right way, and that's what I believe, and that's why I love that, because to me it was so exciting just to get that clear fluid, right? And then after that, one of the other things that I use and there's another device you guys make, and it's called the micropen. Everybody knows of it as a microneedling procedure, right? So they all go to their estheticians, and everyone's doing it. I went to Bangkok when I go speak, and I went to Dubai. Everyone's doing all throughout the world, and Asia is really popular in microneedling. But I want to explain the differences in microneedling, right? So here's like a device, right? First of all, what is microneedling? Can you explain to the audience what this is? What microneedling is in general, and then we'll go into the device.
Yeah, microneedling is exactly how it sounds. Microneedles, tiny little needles. On the Eclipse Micropen Elite, we have 12 32 gauge needles. And
they should be nickel free, right? So a lot of the times the needles are not necessarily free of nickel. And how many people have allergies to nickel?
Absolutely.
Right? So nobody looks at that. So NainaMD does. But that's why I look at these things. Okay.
Very good. So microneedling, what we're doing is we're creating an intentional micro injury to the skin. And this initiates the whole wound healing cascade. Again, we're back to wound healing.
Right.
And so that cascade initiates the production of collagen and elastin and creates skin cell turnover and is great for so many uses. And ultimately, it's called percutaneous collagen induction therapy.
Right, because you can just go and the needles actually vibrate, right? Do you want to just turn it on?
Yeah, they oscillate up and down at a very high rate of speed.
And the technique is that, so the finesse is that you don't want somebody who's just going to glide it. If you're using if you're going thicker, you don't want to be gliding it because you can cause injury. So there's a finesse involved. So one of the things I was talking about is that a lot of times with the microneedling is the needles have to be very important in how you do the technique. I think it's so important how people do the technique. You just can't just give it into the hands of just everyone to do it. And I use certain solutions and things with the microneedling that are just with the hyaluronic acid, which is wonderful to get into the skin. What do you recommend? Do you guys have your own hyaluronic acid?
Yeah, we have our own hyaluronic acid microglide. We even have a growth factor serum as well that you can use with it. But the key to the pens is the tip, and this tip on the Eclipse micropen is sealed. And that prevents any fluid from entering the pen and exiting the pen. So it's really a safe device to use for microneedling.
Right. So tell me, can you control the depth of that pen?
Yes. Mm-hmm.
Yeah, because you can. I usually just turn the dial and I can control the depth too. It's been great. I've had a great results with stretch marks. So a lot of times that's like, what do you do for stretch marks? All my clients come and say, okay, and there's not a whole lot you can really do for stretch marks. I've done from. I had a client that was, she has a pregnancy, and then she had some stretch marks because of the pregnancy. And we did 1 or 2 treatments, and we had really very good results with that. So I use a lot of it, for stretch marks. It's been great.
Excellent.
Yeah, yeah. And I use it, sometimes I use it after, combine it with sometimes my laser treatments. I'll kind of go off and I will do one time laser treatment, we'll do one time the microneedling, and it really gets that collagen buildup going. Yeah, no, I love the device. Thanks for having us on the coming on the show, and we'll have to have you on next to see what you're on to. What's in the frontier of the company? What else are you guys getting into?
Oh, tattoo removal devices.
Yeah.
And who knows what's around the corner.
That's a really big thing. Well, with the tattoo removal devices, it's been very painful, right? So you're trying to obviously come up with a device that's not going to be as painful.
Well, we're coming up with a device that treats all skin colors and all ink colors, which is really nice. And it's not a laser. It's very cool.
Oh, I'll have to. You better stop by my office first.
Okay.
It was good to have you, Jeff.
Thank you.
Very good.